Welcome. I'm the moderator for this micronutrient forum session today. My name is Ruth Peterson, and I'm the director of the Division of Nutrition, Physical Activity, and Obesity at the U.S. Centers for Disease Control and Prevention in Atlanta, Georgia. This session is part of the program Effectiveness Track 3 and will highlight new learnings and what we need to do to advance effective large-scale food fortification programs in countries. When done well, we know the power of large-scale food fortification. We know it's cost-effective. We know it's an efficient way to increase vitamin and mineral intake through staple foods that are regularly consumed, especially for those populations at the highest risk. We have great examples of the effectiveness and benefits of large-scale food fortification. For example, salt iodization has led to improved cognitive development, and folic acid fortification has prevented many neural tube defects. In this session, we'll start with 4 presentations. Our first presenter is Reynaldo Martorell. Ray is a professor of nutrition at the Rollins School of Public Health at Emory University in Atlanta, Georgia. He is also a member of the executive management team of the Food Fortification Initiative. He will present on lessons learned implementing a rice fortification effectiveness trial in India. Rosemary Masaka is the second presenter. Rosemary is the manager for non-communicable diseases, food security, and nutrition program at East Central and Southern Africa, or ECSA Health Community. She will present on the development of a framework for monitoring fortified and nutritious food consumption and program impact in the ECSA region. Our third presenter is Helena Pachon. Helena is the Senior Nutrition Scientist at the Food Fortification Initiative at Emory University in Atlanta, Georgia, where she provides technical support to partners in cereal grain fortification. She will be presenting on a website resource developed by several groups to summarize fortification information for several foods in all world regions. Our last presentation will be by Benjani Mukambalu, the Global Program Lead for Food Fortification at GAIN. Benjani also serves as the Executive Management Team on the Food Fortification Initiative and the Board of Iodine Global Network. He will be giving a report out of the second Food Fortification Summit. We'll then take 15 minutes for questions and answers, and during the presentation, please do submit your questions through the website chat box, and we will get through as many as we can. I want to warn the audience and the presenters that I will be giving the presenters a 3-minute warning when they're close to the end of their allotted time, so don't let my voice scare you if I jump in. So now I'd like to turn it over to Ray for his presentation.
Yes. Hi, I'm Reynaldo Martorell from the Rollins School of Public Health of Emory University. Thank you very much for inviting me to this symposium. I would like to review with you key lessons learned in implementing a rice fortification project in Tamil Nadu. In this presentation, I would like to describe the effectiveness study that we were planning to carry out. Unfortunately, our study could not be completed, but I would like to describe what we did manage to accomplish. Finally, I would like to discuss the factors that impeded us from completing this study and the lessons we learned. The project was called Reducing Anemia Through Food Fortification. 4 of us were the principal investigators, all based outside of India. 3 are distinguished economists at the University of California at Berkeley, at Stanford University, and at Pompeu Fabra University in Barcelona. We began this study with funding from the government of Tamil Nadu, Tata Trust from India, and the Global Innovation Fund in London. India's public distribution system, PDS, is the world's largest social safety net distributing food. PDS is universal in Tamil Nadu, and its basket of goods includes rice. All households are entitled to 20 kilograms of free rice per month, and poor households can claim an additional 15 kilograms of rice. Rice is the main staple in Tamil Nadu. Over 90% of rural households consume rice, and a lower percentage, 66%, do so in urban areas. The amount consumed by households is around 300 grams per person, but only about half of that amount comes from the PDS. On average, PDS rice consumption is 179 grams per person in rural areas and a bit less, 116 grams in urban areas. Our study was a clustered, randomized effectiveness trial carried out in 2 taluks of Kudalore district with a population of 275,000. We were planning to distribute fortified rice through the PDS, and the point of distribution was the fair price shop, which corresponds usually to 1 per village. Our unit of randomization, therefore, was the fair price shop. The intervention was planned for 12 months. The study called for 220 fair price shops or villages to be allocated at random to treatment or control. Within these communities, in rural and urban areas, within each of these communities, we selected at random 40 households to participate in the baseline. This yields a sample size of 4,400 women and 4,400 children less than 5 years of age per group. So this was nearly 9,000 women and 9,000 children for both groups. We had planned to follow up the same individuals in the end line that were measured at baseline. The key outcomes were anemia, iron status, and iron deficiency anemia. We also included secondary outcomes like child growth and child development. Data collection also included detailed information about PDS participation in rice consumption, as well as a variety of socio-demographic data and cost data. There was much that we achieved. We had developed a good fortified product that withstood the local cooking practices with reasonable nutrient losses. The fortified rice was accepted well by the population. We had established the supply chain and completed all of the logistics for blending the rice and distributing it to the fair price shop. Finally, we had completed and analyzed the results of the baseline. Just quickly, this is the formulation we had settled upon. Per 100 grams of fortified rice, it contained 4.5 milligrams of iron. However, we were using co-fortification of ferric pyrophosphate with citric acid and trisodium citrate, which is allowed in India and which doubles bioavailability. We had estimated that women would meet most of their estimated average requirement for iron from fortified rice. The formulation also included zinc, vitamin A, folic acid, B12, and other water-soluble vitamins. These are data from the baseline. They show that the problem of anemia and iron deficiency is huge in women and children. We found that about half had anemia, as had been reported for the entire state. We also measured iron status and found that about 70% had iron deficiency. A large proportion of anemia between 65 and 73% was due to iron deficiency, indicating the need for having a good source of iron in the formulation. Finally, the formulation also included other micronutrients whose deficiency caused anemia, all leading us to expect a large impact. I'm deeply disappointed that we recently were forced to terminate the study. In the rest of the presentation, I want to list for you some of the key reasons that I think led to this disappointment. I have organized these reasons into three large buckets of categories. Unexpected problems. Just as we were in the midst of baseline data collection in August 2018, we suffered a major setback that prevented us from beginning the intervention. We had stockpiled fortified rice and were ready to distribute it. What happened was that the FSAI, the food regulatory body in India, issued standards of fortification that specify concentrations of nutrients far below those recommended by WHO and WFP for India. This made our formulation non-compliant. The government of Tamil Nadu became alarmed and asked us to get permission from FSSAI to use our formulation. We obtained a reply after several months. FSSAI had no objection, and in fact, it looked forward to our results because they might be useful in future reassessments of the guidelines. They also said that there was no requirement for specific approval on their part. However, the government insisted that we get actual permission and not just a statement of no objection. And we again approached them. The response, received some months later, was nearly the same. No objection, but the government at this point allowed us to proceed anyway. By this time, we had accumulated a large carryover in our Tata Trust grant, which made us non-compliant fiscally. There were also staff changes in Tata Trust, and our initial supporters had left. Tata pulled its funding and told us that this was because we had not spent enough of the money as required by regulations. We had to look for a new funder, a new delay, and eventually were successful in obtaining a grant from King Philanthropies. Early this year, we were in the midst of promising negotiations with the government when COVID-19 put an end to any hope of starting the project. As time passed, there were some changes in government officials, and not all valued our study as was the case before. Over time, there was some erosion of support, and our study came to be viewed as a foreign study. Let me use testing nutrient levels as an example of problems we encountered because of the lack of trust. The government insisted that we test the premix, the fortified rice kernels, and every new batch of blended rice for every single nutrient. We felt that the testing could be simplified as done in other countries, but we were not successful in convincing the government. We were also concerned that some of the assays were difficult to standardize. The laboratories were selected by tender, and as we feared, we soon had multiple reports of erroneous results that were proven wrong after testing the samples in a high-quality laboratory in Bangalore. This process of gaining acceptance of our test results took time. Future projects will have it easier because the testing protocols have been simplified by FSSAI. The onus is now largely on manufacturers to do the testing. Our partner on the ground was JPAL, a well-respected organization with expertise in social science collection, social science data collection. However, JPAL lacked expertise in nutrition and in food fortification, and we managed these aspects of the project over phone calls and by periodic visits. JPAL had no expertise or credibility with the government with issues such as testing. My last trip this year to anywhere was in March to Tamil Nadu, just as the COVID epidemic began to spread rapidly. JPAL has many projects across India and in Tamil Nadu, and relationships with government are very important. JPAL began to be concerned about its reputation, enhanced by a Nobel Prize in Economics in 2019 to its founders, and narrow its role to conducting the just the end line to reduce its exposure. We were completing agreements with another organization to fill the vacuum left by JPAL when COVID-19 struck. We had no choice but to close the project.
Ray, you're at a 2-minute warning.
Final comments. It is ironic that there is currently an effort by the central government to scale up rice fortification through the PDS across various states in an interest in evaluating this experience. We remain very interested in rice fortification and are exploring opportunities in the evaluation of these efforts. We will take the lessons learned to heart going forward. Two are critical. First, the fortification scheme must be owned and implemented by the government or by agencies awarded contracts to do it. It seems that future efforts in rice fortification in India will be in fact implemented in this manner. Second, a local and equal partner with expertise in nutrition and food fortification is required so that it can adequately represent the project before government. We feel that in our case, some of the delays may have been avoided or shortened appreciably with a strong local technical partner on board. India has been struggling with addressing anemia, and I sincerely hope that rice fortification will achieve success. Thank you.
Thank you, Ray, for that great presentation. We do have a few questions already in the box, but I'm going to go ahead and move us over to Rosemary to share with us the advances in the initiative in the ECSA region. But we really appreciate your presentation and the lessons learned that you took to heart, which is really important given the barriers that you ran into, and sharing those negative things are really important for all of us to learn. So thank you. And I'll turn it over now to Rosemary.
Thank you, Ruth. So I'm Rosemary from EXA Health Community. So I'm presenting on the advances in food fortification initiative in this region, specifically on development of framework for monitoring consumption and program impact. So EXA, as the intergovernmental organization, has been implementing the food fortification initiative, supporting the member states and country beyond on implementation of this fortification as the high impact nutrition intervention. So it started in 2002 when the EXA Health Community, this is the highest governing body, the Conference of Health Ministers, passed a resolution to direct the member states to implement the food fortification. So we started with providing the access to financial and technical expertise to the member states to enable them implementing the program, policy support, regulatory, as well as the technological support, and lastly, on the monitoring and surveillance. So in 2015, we partnered with the support from USAID. We supported the 13 countries to strengthen the capacity to monitor fortified as well as nutritious food. So this presentation emanated from the study, which was done in 13 countries to assess the consumption monitoring and surveillance, as well as the framework for monitoring the food fortification. So the objective of the study was mainly to determine the status of consumption monitoring and assess the impact of the program and identify the sources and methods used in consumption monitoring, and what methods also are used to assess the program impact, and review the linkage and exchange among stakeholders in countries to establish capacity gaps and inform development of regional framework on consumption monitoring and program impact. So the study was done in the 13 countries as listed in the presentation. So the study methodology, the study was done through the desk review of the secondary data from the 13 countries, and this was backed up with the key informant interview and focus group discussion, as well as the observation. And it involved visits to 12 out of these 13 countries. So physical visits were done and consultation were done with the key stakeholders who are directly involved in food fortification, from the government, private sector, as well as the development partner. The market information from the millers, consumers, and other relevant survey were also compared, and as well as the interview with other key stakeholders, including those from the National Food Fortification Alliance. All these were analyzed to inform the assessment report, as well as the formation of the regional framework. So the study had some limitation, but the assessment were mainly relying on the secondary data on the micronutrients, that is coverage, provision, and intake. So you'll see that the nutrition indicators were not consistently available across the region. And it was also difficult to establish the program impact, since data were rarely collected in most of the countries. So you find that the frequency were very low. We found that there are a lot of missing information from the countries. So the surveillance system also for fortified and nutritious food has not been set up in most of the countries which we did the assessment. And it was also difficult to obtain some information from the respondents we selected due to the false promise. They failed to deliver some of the information. So those were some of the limitations. So as the key finding following that assessment, we found that out of the 13 countries, all of them started to implement the mandatory universal salt iodization since 1990s, and mandatory fortification of wheat flour, maize flour, and edible oil is done in at least 8 out of the 13 countries assessed. And mandatory legislation on sugar fortification is done in Malawi, Mozambique, Zambia, Zimbabwe, as well as in South Africa. So you can see that there are huge achievements in this area. In terms of consumption monitoring, you find that the major source of information related to consumption monitoring were obtained from the dietary assessments, food fortification rapid assessment tool, as well as the FRAT and FACT assessment to assess the coverage, supported by different partners, household consumption and expenditure surveys, FAO food balance sheets, and industrial production data. So these were the major source of data in all the 12 countries assessed. And FRAT, we noted that FRAT has been done by a number of member states, by the number of countries which we did the assessment to inform the effective implementation of mass fortification program. Household consumption and expenditure survey were also conducted at least after every 3 to 5 years. Monitoring information system and evaluation frameworks are in place to ensure quality improvement. We also noted that Kenya and Uganda have online platform with comprehensive data on food fortification. So we can say that these are monitoring and evaluation framework specifically on food fortification. Zimbabwe, we are making some efforts to incorporate food fortification in the Zimbabwe Health Information System, and Uganda had integrated food fortification indicator into its annual national household survey. So we also noted that consumption monitoring has not been effective rollout in the EXA countries due to inadequate foregoing systems of regulatory monitoring, enforcement, as well as inadequate resources to support the independent surveys. In terms of surveillance of fortified and nutritious food, we noted that countries in the EXA region have not systematically pursued surveillance of food fortification. Only a few countries conducted the National Micronutrient Survey, including Ethiopia, Kenya, and Malawi, who did at least 3 times, Mozambique 2 times, and Zimbabwe, at least they did once. So several attempts we have made to include the micronutrient status indicators in DHS. As you can see that Malawi did it in DHS 2015-16, Rwanda 2019-20, and for Tanzania, plans are underway to do it, to incorporate in 2021 DHS. Uganda National Panel Survey integrated a nutrition model with micronutrient biomarkers starting in 2018. So the national representative data on nutrition, on micronutrients deficiency are limited as compared to other nutrition indicators. Zambia and Mozambique established the National Nutrition Surveillance System. So as I've said that this assessment informed the development of consumption monitoring framework. So they proposed the framework which came out after this assessment, comprised of 3 areas: the processes, phases, and components. So the assessment informed that, okay, it's important like to have these 3 components, and all this should be backed up with the key pillars, which are the policy and legal framework, capacity building, advocacy, and resource mobilization. So under each element, you'll find that there are lists of activities which we propose that should guide or should serve as part and parcel of this framework to inform the effective consumption monitoring and surveillance of food fortification programs in our countries.
And Rosemary, you have 1.5 minutes left.
Okay, so in conclusion, they say that consumption monitoring and surveillance has not been done or has not been conducted frequently and so there is a gap in terms of this information. In most cases, program impact has not been done in most of the countries, with the exception of salt, where a number of countries have done impact studies to establish the effectiveness of the consumption of iodinated salt in the region. So we recommend that for effective consumption monitoring, surveillance of and impact evaluation, we require supportive legislative framework and policies, enhance the public policy, public-private sector partnership, capacity building of key stakeholders, resource mobilization, as well as development of information platform on food fortification. And also, we recommend that consumption monitoring and surveillance framework should consist of various processes, phases, and components, as well as the domains that provide an enabling environment for this to happen. So we acknowledge the collaboration we had with this list of organizations. Thank you.
Great, thank you so much. That was an excellent presentation, and again, speaks to the importance of surveillance, impact evaluation, and also setting up systems to monitoring quality improvement. So we really appreciate the work that you've done and what you presented. Thank you so much. And now I'd like to turn over to Helena to talk with us about the Global Fortification Data Exchange. Helena, turn it over to you. Great.
Terrific. Well, thank you for the introduction, Ruth. I'm pleased to make this presentation on behalf of the Secretariat for the Global Fortification Data Exchange, or GFDX for short. I would like to acknowledge the current members of the GFDX Global Secretariat, individuals who have helped us collect data for the GFDX, and the financial support from the Bill and Melinda Gates Foundation. The Global Fortification Data Exchange is a collaboration among the Food Fortification Initiative, the Global Alliance for Improved Nutrition, and the Iodine Global Network. The GFDX is an online visualization tool that aggregates and displays data on 5 fortified foods: maize flour, oil, rice, salt, and wheat flour. Conceived in 2015, the GFDX website launched in 2017. Data are available in English at fortificationdata.org and in Spanish at fortificaciondatos.org. For example, this visualization in Spanish has a list of the countries with protocols for government monitoring of domestically produced fortified oil in green and of imported fortified oil in blue. This includes Bangladesh, Bolivia, Cameroon, Cote d'Ivoire, and others. The GFDX displays data on up to 196 countries. This map, for example, shows that the GFDX has data on salt intake from 123 countries. We can see from the legend that salt intake ranges from 3 to 15 grams per capita per day. The GFDX data and codebook can be freely downloaded for subsequent analyses. In the past 3 years, the GFDX website has had over 19,000 users from 187 countries. In the past month, we have launched 3 new visualizations. One is an assessment of whether national standards align with WHO guidelines for fortification compounds and nutrient levels. This information is available for the 3 foods that have such guidelines: maize flour, salt, and wheat flour. The second is the potential nutrient contribution from fortification. This analysis focuses on all nutrients and country standards for the 5 foods listed. The third is a review of the health status in countries based on before and after studies of large-scale fortification implementation. For 11 biomarkers, the GFDX provides a count of such assessments conducted in countries and whether there was a change in the biomarker after fortification. The GFDX has visualizations on 3 families of indicators. One group of 5 indicators helps us to answer the question, is there an opportunity for fortification in a particular country? For example, the GFDX lists the percent of food that is industrially processed in a country and thus easier to fortify by industry and easier to monitor by government. The second set of 9 indicators allows us to determine if a fortification program has a good foundation based on a document review. For example, the presence of mandatory fortification legislation generally results in fortified food reaching the most vulnerable populations in a country. And with the final set of 4 indicators, we can decide how well a fortification program is performing. For example, the percentage of food that is fortified is one way to determine if a fortification program is operating as planned. In the rest of the presentation, I will show you how you can use the GFDX to answer these questions. Let me first orient you to the English language website at fortificationdata.org. From left to right, the black menu bar has About Us, Countries, Data, Methods and Sources, Media Center, Resources, and a link to subscribe to our newsletters. Under Data, one of the drop-down options is Visualizations. You will have several options to choose from. Under Country Dashboards, you can find a summary of all the fortification information we have for each of 196 countries. This is our most visited visualization. The next 3 categories are the families of indicators I mentioned earlier: fortification opportunity, foundational documents, and program performance. Finally, if you would like a tour of how to navigate the website, you can click on How to Use. In the Africa region, is there an opportunity for fortification of maize flour? This visualization lists the percent of maize flour that is industrially processed in all countries from the Africa region. The higher the percent industrially processed, the higher the feasibility of fortification. This chart suggests that Botswana, Cote d'Ivoire, and Gabon are potential countries to explore maize flour fortification because of the high proportion that is industrially processed. Whereas Cameroon, the Democratic Republic of Congo, and Eswatini are not, because of the low proportion of maize flour that is industrially processed. For Botswana, Cote d'Ivoire, and Gabon, we want to know how much maize flour is available for human consumption. The higher the amount, the greater the likelihood that this is a good fortification vehicle. 114.9 grams of maize flour are available per capita per day in Botswana. For Cote d'Ivoire and Gabon, the estimates are much lower. From the information on this visualization and the previous one, we would pursue the possibility of maize flour fortification in Botswana. An NGO wants to support countries with their fortification efforts and decides to focus on strengthening the foundations of country programs. They ask themselves if most countries that have wheat flour fortification standards currently follow WHO guidelines with respect to using recommended compounds. For folate, all countries with folate in their standards are dark green in color, meaning that all of the compounds in the national standards are WHO recommended. That's positive, and it means countries do not need assistance with reviewing their folate compounds for wheat flour fortification. For iron, we can see in the legend that there's much more of a mix. Dark green countries are those where all iron compounds are in standards, all iron compounds in the standards are WHO recommended. Yellow countries are those where none of the iron compounds are WHO recommended. Light green countries are those where there is a mix of recommended and non-recommended iron compounds. And orange countries are those where the iron compound was not specified. Based on this map and the previous one, the NGO may want to spend some time supporting countries with their choice of iron fortification compounds in wheat flour standards. You are a new nutrition officer in the Ministry of Health in Thailand, and your boss has stopped by your office. She wants to present an effective project going on in Thailand at a global meeting. She asks you what she should present. You go to the GFDX website as a source of data to demonstrate the effectiveness of salt fortification with iodine. Thailand has a health assessment, pre and post program implementation. The outcome studied was median urinary iodine concentration. You go to the data tab on the bottom of the screen to find out what this health assessment found. Thailand's salt iodization program began in 1994. There are measures of median urinary iodine in 1993, before the program began, and in 2015, 20 years later. Median urinary iodine values increased from 81.8 to 156 micrograms per liter. In conclusion, there was a positive health change observed after fortification of salt with iodine in the country, and you provide this information to your boss. In summary, the Global Fortification Data Exchange is an online visualization tool that aggregates data on maize flour, oil, rice, salt, and wheat flour. Data are available in English and Spanish for up to 196 countries. All the data can be freely downloaded for you to analyze further as you wish. The data on the website can help you answer these questions. Is there an opportunity for fortification in a particular country? Does the fortification program have a good foundation? And how well is a fortification program performing? In closing, we hope to have piqued your interest in the Global Fortification Data Exchange, and we invite you to visit the website at fortificationdata.org. Thank you.
Thank you, Helena. What a great presentation. It's exciting to see all the information that you've gathered collectively across the world, and then notably the visualization of it. So it makes it appealing for people to reach to that information and share with their boss, as you say. So now I'd like to turn it over to Panjani to give us a report on the second Food Fortification Summit from Friday, and really appreciate his time with us to share. Panjani, turn it over to you.
Thank you very much, Ruth. So a little bit of the background, the summit was initially meant to be held in Bangkok back in March, but of course it was postponed because of COVID. So it's now being held as a series of virtual events. And last Friday was the launch session for the summit. The objectives of the summit are, broadly speaking, threefold. One, to sort of take stock on what's happened over the last 5 years since the first summit was held in Arusha. And then secondly, to look at the status of, fortification and biofortification, programs globally at present. And then going forward, what are some of the priorities over the next 5 years or so? So last Friday, we essentially had 3 sessions. One, looking at fortification and biofortification as, national food systems interventions. And then the second session was on the unfinished agenda on fortification. What is it, and what are some of the solutions to the challenges we see in programs? And then the final one, pretty much talking to national leaders in terms of what they're doing on fortification and biofortification programs. So what I'm going to present today is sort of a summary from all those 3 sessions and the call of action that was issued at the end of that launch event. So to start with, the first session, which was shared by Andreas Brothina from the Gates Foundation, had a variety of speakers from the United Nations, from donors, from government, from fortification implementing agencies, and indeed from the private sector. And it was opened with a keynote address by the executive director from UNICEF. In a nutshell, what came out of that session was, reiterating both fortification and biofortification as food systems interventions. Fortification being one that's been around, for 100 years, and solarization being quite a global success, with 90% of households globally having access to iodized salt. But biofortification is emerging. It needs to be scaled up, but it's a promising opportunity. Looking back to Arusha, since Arusha in 2015, 11 countries have passed mandatory legislation on one or more, food vehicles when it comes to fortification. Some have large-scale, voluntary programs. A good example is India on oil. But cumulatively, if you look at, since Arusha, over 700 million more people are being reached with fortified products. India is on the cusp of mandating oil fortification and has made a commitment to mandate rice fortification within the next 3 years. The other thing that was looked at was the COVID context. I'm not going to spend a lot of time on this because we got a session coming up on COVID. But also another issue that came up is, yes, we talk about public health and it's important, but we need to make the economic case for fortification, even more. And then also the need for partnerships between donors, government, and private sector. Yes, it's a public health intervention, done through the private sector, but ultimately it's a web of partnerships that are important and that are at the heart of the fortification if we have to address and finish the agenda. And an important point that was made by the UN Food Systems Summit envoy, Agnes Kalibata, was, for the fortification community to sort of integrate and embed themselves within the processes of the Food Systems Summit and the Nutrition for Growth so that governments can make commitments around those. So that was the summary from the first session. Moving on to the second session, this was more around, what's the progress, what is the unfinished agenda, and what can we do about, those challenges. So to start, looking at progress over the last 15, 20 years, there's been huge progress made on mandatory legislation. So on grains, for example, that's wheat, maize, and rice, 85 countries now have mandatory legislation. But when you take into account programs or countries where they have voluntary programs, then we're talking, over 110 countries implementing, grain fortification programs globally. At the end of December last year, the Food Fortification Initiative, put together data that estimated the volume of industrially milled grains. And they estimated that there's 517 million tons of grains that are industrially milled globally. But when you look at the estimate in terms of how much of it is fortified, then that's only 19%. 30% each for maize and wheat, and only 1% for rice. So that's a long way away from scale up on rice. Early this year, a number of organizations, myself included in that, we looked at, if we were to scale up grain fortification or fortification programs generally, where are the opportunities? And this was based on the prevalence of micronutrient deficiencies and also the presence and consumption of food vehicles where it's consumed at a scale where fortification makes sense. So we estimated that at least 40 countries, based on those two criteria, would, qualify fortification programs. Of course, further analysis needs to be done on some of the countries with regard to the level of industry centralization. Moving on to salt, this is perhaps the most advanced. So there's over 145 programs globally, 128 of them on a mandatory basis. But if you look at the Iodine Global Network Nutrition Scorecard, which was published in June this year, 20 countries are still, iodine deficient. That's to say that the intakes of iodine are insufficient. So there is, that unfinished agenda for those last 20 countries on salt iodization. Oil is lagging behind grain and salt fortification. So there is 36 countries with standards, either voluntary or mandatory. And we estimate that up to 70 countries can benefit from new from new oil fortification programs. That's fortification with vitamin A or vitamin A and D. Coming to existing programs, we see a number of challenges. So what this graph shows is data that was aggregated, based on surveys that have been done using the Fortification Assessment Coverage Toolkit. And essentially, some of the two key challenges come up. One is to do with, compliance, and the other is to do with coverage. So I will use the example of salt here. Bear in mind, this is just a small fraction of programs. So 21 surveys, but there is over 140 programs. So this is just an indicator of what's happening in programs. So if you look at this graph on salt, what we found across those 21 surveys is that 99% of households consume salt. So that's very good coverage. 95% of them consume salt from sources where the salt is industrially processed. So again, very good vehicle for fortification. But when you actually test for the levels of iodine, 65% of the salt was fortified, but only 31% was fortified according to standards. So what this shows is, two big gaps, one to do with coverage and the other one to do with quality. So in a nutshell,
you're down to 1.5 minutes.
All right. So in a nutshell, we see these three key things that we need to do in fortification programs. One is to do new programs, as I've already talked about. The second is to do with new innovations to improve on compliance and coverage, whether it's looking at systems, whether it's new food vehicles, and complementarity between fortification and biofortification. And the other one is to do with assessments and evaluations. The final session was from national leaders, as I already said, and essentially, they all agree that fortification and biofortification are two food systems interventions. There were inspirational stories from cabinet ministers from all these countries listed here, but also challenges. But they did say challenges remain and more partnerships are needed. So to sum up, there was a call to action at the end of the summit. And first is about embedding fortification and biofortification within the Nutrition for Growth and Food Systems Summit processes. And secondly is, we all have a role to play in terms of addressing the unfinished agenda. So pretty much all the key issues that I pointed out, and there's roles for governments, for international organizations, donors, industry, civil society, and researchers. So that, in a nutshell, was what transpired at the Fortification Summit. Thank you.
Thank you so much, Benjamin. That was so interesting. What a great presentation that was to summarize the great session on Friday morning. And there is an unfinished agenda. So we will definitely be discussing that. Just for those of you in the audience, remember in the panel discussion that's coming up. But right now, what I'd like to do is go with some questions that have come in from the audience while the presenters were presenting. And based on the ranking system, I'll ask the presenters to respond. We have about 10 to 14 minutes to do this, and then we'll introduce the panel and continue our exciting moment here. So the first question goes to Ray. And Ray, can you please explain the reasoning for the choice of ferric pyrophosphate, and what were the other candidates, encapsulated or not?
Thank you for that question. We consulted with experts and reviewed the literature, and ferric pyrophosphate works well in rice, and we were particularly intrigued by research from Switzerland. There is a paper by Hack and colleagues in the American Journal of Clinical Nutrition that showed that encapsulation, as I described it, doubles the bioavailability of ferric pyrophosphate, so making it, as good as anything you could add in rice. So that's the reason.
Great, thank you so much. Ray, this next one is for Rosemary. So Rosemary, based on your experiences supporting countries in your region, what are the key challenges that hinder effective consumption monitoring and surveillance of food fortification programs?
Okay, thank you. So most of the countries which I've been working with, we found that they lack the technical capacity to undertake the consumption monitoring, as well as to evaluate the impact of food fortification program. And also we noted that the financial resources. So in most cases, you find that they can plan for it, but when it comes to actual implementation, a lot of excuses comes in. So we thought that it's important to have the innovative partnership to come up with the alternative financing, maybe from the private sector, to complement the donor efforts. So yeah, shortly, these are some of the key challenges I should talk about.
Great. Thank you, Rosemary. Helena, this one is for you. The question is about, in terms of assessing the fortifiability of a food vehicle, considering the availability of that food from both the domestic production and the industrial milling perspective, along with the trade landscape, it's really important. So any thoughts about considering the availability of foods by separately reviewing them from those two perspectives to really help better design and implement fortification programs at a country and regional level?
Yeah, so we definitely include both of those measures. The as you saw in the example, the amount that's available for human consumption or intake, and also the amount that is industrially processed. And we would say, this information is there to help with decision making. It's not the end all be all. If you look at those two pieces of data, you're going to have all the information you need. Because, for example, you may be in a country where there is no one strong food vehicle, but maybe 2 or 3 foods do reach most of your population. Therefore, if the availability of those 3 equals a large amount, then maybe you'll consider the 3 collectively. So it's just a starting point to those discussions. Thank you.
Great. Thanks, Helena. Rosemary, another one for you. Can you please talk about the next steps for the monitoring consumption and program impact in the ECSA region?
Okay, for us as an intergovernmental organization, we are mandated to support the countries. So it's an area which we have realized that it needs further support. So we'll continue to look for partnership to strengthen the support in this area, knowing that there are a lot of gaps, which you have already seen. So we'll invest more to see how we can use the technical expert from other partners to support the countries and do the systematic follow-up the countries to see what is really emanating, what are the new developments, and how can we just chip in to complement the effort. And we also will support the countries to implement this framework, because we have not really done it. We just developed, but we have not supported the countries, and we have seen that the gap is vivid. Now it's time for us to strengthen the support here.
Great, thanks, Rosemary. Panjani, this one's back to you. And the question is, so what happens next after the virtual high-level summit last Friday? How can people get involved?
Yeah, so that's a good question. So as I said, the summit is a series of virtual events. So after the high-level summit, over the next year, we're planning 3 different types of events. So the first one is a range of webinars. That's going to be between 8 and 10 webinars covering a lot of subjects that comprise the unfinished agenda for fortification. So you heard me talk about the challenges around compliance and coverage. So pretty much, so what do we do rather than talk about the problem? How do we innovate around, remote monitoring through digitization, for example? What are some of the business models that are going to push, the fortifiability, frontier? What else can we do in terms of data collection at national and subnational level. So it's a whole range of topics and subjects, including emerging vehicles on food fortification, rice being one of them. And, a wide range of partners are involved in that. Coupled with that, there's going to be some, national level summits, and that's mostly to mobilize governments in terms of making, specific commitments. And we think, and we're hoping, fingers crossed, we're going to be able to have a side session at the Food Systems Summit. That's September, October next year. We hope we're going to have the world coming back to some sort of normalcy then. And that will be, the culmination of a year's work with all these events. So, how do people get involved? Yes, they can reach out to us by emailing us at, futurefortified@gainhealth.org. But they can also take part in discussions on the summit within the Global Fortification Technical Advisory Group. So that's what I would say about that one. Thank you very much.
Great, thank you so much. Helena, this next one is for you. Can you tell us why sugar information has not been included since fortification with vitamin A has been successfully used in Central American, African countries such as Nigeria and Zambia, and Malawi was shown efficiency in reducing hypovitaminosis?
Thank you for that question, Ruth. The three organizations that are the data stewards for the Global Fortification Data Exchange, we each historically have had a self-imposed mandate for collating and presenting information on different foods. So the grains, for example, the Food Fortification Initiative has taken on that leadership. For salt, it's been the Iodine Global Network, and for oil, it's been the Global Alliance for Improved Nutrition. The reality is that we don't know of any organization who their mandate, self-imposed or otherwise, is to monitor sugar fortification. And so that's been one of our hesitancies of including a food, because we really need an organization that this is what they do and they want to be involved with us in the long term to collect this information, not just one time, but on a regular basis. So this information needs to be collected and is updated on a daily basis. Thank you.
Great, thank you, Helena. Ray, this question is for you. The question is, what is the point of start for rice fortification initiatives for any country that's planning to start this program? So Nepal is starting from helping rice factories establish the blender, but your study was giving warning signs since government regulatory measures sometimes can appear as bottlenecks in moving forward.
I think what happened to us in India, it's unusual. And in Elena's presentation, she talked about the importance of keeping track of legislation, of guidelines, but also the quality of the guidelines using WHO recommendations as a standard. So I think this is unusual, and I don't know the situation in Nepal at all, but so it's not much I can say. In terms of the point of start, that's a general question. I would say, well, is there a problem to solve in terms of micronutrient deficiencies? Is rice a good vehicle that can reach the high-risk groups, and is there political will? There are many other aspects, but I would stop at that. Thank you.
Great, and while I have you, Ray, the next question is also to you. Did you produce the rice premix? And I'm asking because the micronutrient contents were higher than other formulations, and I'd like to know if those are compatible with the fortified rice kernels.
The premix was manufactured in India, and we followed WFP recommendations. There is a paper by Saskia DP in the Annals of the New York Academy of Sciences, where her group suggests levels of fortification given levels of consumption of rice, and so we were following that. It only differs in that the amount of iron we have in the premix is lower than what she had in that paper because we're using this chelation that enhances bioavailability. But that's what we followed WFP recommendations.
Great. Thank you, Ray. A general question with no real identification of who wants to answer it. So the question is, in the fortification community, we're all working on similar things. Technical assistance, business models to make fortification attractive for the private sector, QA and QC, monitoring and enforcement. How can we better pool resources and combine efforts to avoid duplicating efforts? Helena.
Certainly on the data side of any of that, we welcome you to contribute any information that you might have that we can then put on the website so that everyone has equal access to that information. Thank you.
Great. Anyone else want to add?
I think there's also examples of countries, of partners working together in countries. So I have seen as part of national fortification alliances, for example, subgroups of technical or implementation agencies or as standalone, coming together, looking at who is doing what, and so there is better coordination. Is it something that I think the community needs to do more of and better? Yes, I think I would say there is scope to do more of that, but better coordination in country, either through technical alliances of the agencies or as part of the broader frameworks, whether it's fortification alliances or any other coordinating mechanism. I think that's a welcome development. I see, Rosemary, you wanted to come in, so I'll defer to you.
Thank you. It's the same point. I think it's important to strengthen the collaboration, multi-sectoral collaboration, as most of the countries now are moving towards developing the multi-sectoral policies and plans. So it's important, even when doing the planning, those key sectors, those key stakeholders should be part and parcel through the existing alliances and also through the existing technical working group. They should be part and parcel of the discussion.
Great, thank you. And we have one more minute, unfortunately, and we have a great question that I'll turn over to whoever would like to answer it. How should countries manage the potential flows of under or unfortified foods across national borders?
Certainly, the strengthening of the regulatory agencies' work, making sure that they have the power to be able to inspect foods that are coming over the border. That's really important. I think in places where there are regional alliances, making sure, for example, alliances such as ECOWAS in West Africa, making sure that those alliances permit that regulation so that every country gets the kind of nutrients that they need to meet their nutritional needs. But overall, it's something that makes sense and is the minimum that's required for that region. So to have more of that conversation, I think, is very important. Thanks, Ruth.
That's great. Well, thank you. Well, thank you to our great presenters. Thank you for all the questions from the chat box. I'm going to use this time to transition us over to our panel discussion on the future of large-scale food fortification post-COVID with both the short and long-term perspective. So I'd like to first set the stage before I introduce our panelists. And what we've really seen in this session with these lessons learned across program implementation research, advances in development of consumption monitoring and impact framework, we've also learned about good sources of food fortification data in GFDX. And we heard from Panjani about the leadership advocacy and commitments that were made during the second Food Fortification Summit. So we've seen all of this really good work that's in place, but we really know that more is needed. And there's, as Panjani mentioned in his presentation too, there's an unfinished agenda. And I know we all feel that in accelerating the reach and the effectiveness of large-scale food fortification. Again, both in that short term because of COVID effects, but also in the longer term. So we know that large-scale food fortification has a critical role in reducing malnutrition, increasing the resilience of populations against COVID-19 and other public health emergencies. And it serves, as we've heard too, from the work in India and other countries, as a safety net, providing essential nutrition to populations worldwide. But during this pandemic, countries have been affected by disruptions to their international supply chains, both in their staple fortifiable foods, as well as in their vitamin and mineral premix. There have been disruption to trade and markets, and there have been huge transportation challenges with associated price volatility. The stay-at-home orders and the movement restrictions have impacted government regulatory monitoring of the industrial food fortification. It's led some countries to even suspend mandatory fortification. All of that threatens to undermine the important achievements of large-scale food fortification to date. So I'm very pleased to have our panelists here, and I'd like to ask each one of them to spend 3 to 5 minutes reflecting on this unfinished agenda to advance the reach and effectiveness of large-scale food fortification in countries. And please include the impacts of COVID-19 today and into the immediate future, but also give us a look into your vision for the longer term and what's really needed to advance large-scale food fortification. To start the panel, we will hear first from Dora Panaglides. She is the team leader for the EU Food Fortification Advisory Services, which is jointly being implemented by Landell Mills and Gain. So Dora, please start the conversation by reflecting from your position as an advisor and a subject matter expert. I turn it over to you.
Okay, thank you very much, Ruth, for that introduction. And first of all, I'd like to thank the organizers for inviting me to join this panel. I wanted to start off first by just giving a brief background about the EU involvement in food fortification, because you might not really be aware of that, or you might not think about the EU when you think about food fortification. So it really started with the major commitment that they made at the last Nutrition for Growth Summit. Following that, they decided to initiate a so-called pilot projects in food fortification, and that includes all types of fortification, micronutrient powders, industrial fortification, as well as nutrient-enriched crops or biofortification. And this was really for them to see, if they would like to continue invest in this area. And together with that, they supported the establishment of this food fortification advisory service. And what we do is we provide technical support to EU country delegations that are implementing food fortification programs. There are currently 10 projects in 8 countries in Africa. We provide support at the global level to colleagues in Brussels around food fortification policy and programming. And we also are supporting a research component, which is really looking at gaps in, trying to fill gaps in knowledge around fortification programming. Now, that commitment, it has been met from the last Nutrition for Growth. And so, where are we now? I think we've heard over the last few days, we know over many months of COVID now that nutrition is even more important now, more than ever, and making sure that we have fortified foods available and accessible, affordable to the most vulnerable populations is absolutely critical, whether they're through social safety net programs or through market-based programming. So from where I'm sitting, what would I say? I think Panjani touched on a lot of that, and what came out of the Fortification Summit is we need to we need to essentially ensure that ongoing programs are continued, that they're scaled up. We need to invest and consider new countries. I mean, I think he mentioned that over 40 countries could use support in grain fortification, over 70 in oil, but we do need investments in that. And furthermore, I think we also need to continue to support collection of data and evidence around programming in order to help decision makers at country level and globally, of course. And the EU is now also supporting a supply chain assessment, looking at disruptions in that related to food fortification to help inform, again, programming at country level. So it's I think in terms of looking at currently versus the longer term, we have the unfinished agenda. It was even before COVID. We need additional investment. I'm really happy to say that the EU has finalized a fortification guidance note for their country delegations. This is really operational guidance. And so it really demonstrates that while it started off as a pilot, they're really in a position now to scale up this cost-effective, known, impactful intervention. So I really would encourage all of you working at, working in so many of these countries to please consider engaging EU colleagues in country level dialogues around improving nutrition and sustainable development. We know that just having a guidance note or even having resources is insufficient. We need to have national leadership, political will, a dialogue. I think Panjani mentioned some of those as well. So I would say that all of this together is one way we can help to close the gap on the unfinished agenda. Thank you.
Great, Dora, thank you so much. And for the next question, let me please introduce Rizwan Yusufali. Rizwan is the Regional Director for the Strengthening African Processors of Fortified Food Program in TechnoServe. Rizwan, over to you.
Thank you, Ruth. First of all, thank you to the organizers for allowing us to participate on this. So I'll talk a little bit about, just to give you an overview on some of the work TechnoServe's been doing in Nigeria, Kenya, and Tanzania through funding from the Gates Foundation. Our primary mandate in all three countries is to try and achieve the large-scale food fortification objectives, targeting multiple food vehicles in Nigeria, working on wheat flour, sugar, salt, and edible oil. In Kenya, we're targeting wheat and maize flour, and in Tanzania, wheat flour, edible oil, and maize flour. Our approach is primarily based on two main components. One is working very closely with the private sector. We do believe that the food processing sector has a central role to actually achieving the food fortification objectives. But in Nigeria, we also look at some of the work that creates that enabling environment and strengthens the business case for food fortification. So this is more of the scaffolding that would be required to sustain fortification efforts. So as a background, we launched this program in late 2016, early 2017. All these countries had mandatory fortification legislation that was in place for almost a decade at that time. But yet, data that was from surveys was showing that compliance levels are still fairly low after 10 years of implementation, hovering between 30 and 50% at best, with perhaps an exception of salt in Nigeria. So one thing sort of at the onset of the program, we realized that there was a large amount of fatigue from the private sector. They're not central to the program. And that sort of engagement was very necessary. And sort of after 4 years of implementation now, we're seeing some good results with that approach. We're seeing compliance levels rise tremendously. In Nigeria, we're hitting 90% plus compliance levels in wheat flour, sugar, and salt. Also making positive turns on edible oil. In Tanzania, we've seen tremendous improvement in wheat flour and edible oil compliance levels, again hitting 90%. Kenya, while there is a positive trend towards improvement, it is largely hindered by the quality of premix, which, if improved, can achieve that high levels of compliance. So let me take this opportunity in terms of what have we learned, some of the good practices, and what we find resonates with leveraging that private sector involvement and commitment to food fortification, which is so central towards achieving those objectives. And the first thing is generating actionable data. I'm very pleased to see and hear about all the work that is being done around making that more accessible, GFDX, and I think technology allows us to peer into a lot of data. But what we found at the onset of the program first was the kind and quality of the data that was actionable by the industry was lacking at the level of granularity that the industry could respond to. So you need the data on what products are doing at brand level, what market shares are, what are the issues with fortification compliance if they're not met. A big discovery for us in Kenya, for example, as we were doing this and generating this data, realized that it wasn't even the food processors, it's the quality of the inputs that matter. Premix quality is something that is frequently ignored and not regulated heavily in many countries. And that has such a huge bearing on compliance. The second point was around private sector sort of engagement had to be at both tiers. You need the senior level and executive buy-in as well as the operational level buy-in. Some of the things like we've done in the program, for example, in Nigeria with engaging, we hold an annual CEO forum where we get the top industry leaders to come in and they should hear why they should be fortifying. But at the same time, we're working under that space with operator level folks to build their capacity on training and knowledge and expertise transfer, working through industry associations in Kenya. And then the third lesson for us and experience on particularly engaging with the private sector was the approach, or there's been a lot of effort in the past around delivering technical assistance, helping food companies, but it needs to be broadened to get that business buy-in. We feel that it needs to be more holistic and also include some of the operational challenges, competitiveness, the profitability of businesses, and operational efficiency. Ruth, you mentioned at the beginning of the panel, how is COVID impacting? What are the risks of COVID on food fortification? And they are not unusual. I mean, yes, it is an unprecedented global crisis for the industry, but that's something that they have faced all along in producing foods. So looking at some of the operational aspects of it, looking at how can we make industries more efficient, not only helps food fortification programs, but it makes them more resilient to handling crisis.
Great. That's so great, Rizwan. We have to move along to our next panelist. So thank you so much for those thoughts. I want to turn the third question to Pinjami Mukambula, who we met earlier as a presenter reporting out on the second Food Fortification Summit. But Pinjami, can you please reflect from the perspective of GAIN and what the NGO sector can do?
Sure. So, I mean, I will address my comments mostly with the COVID framing in mind. So, I mean, as you rightly said, what COVID has done is to disrupt supply chains. And one of those supply chains that have been disrupted badly is to do with premix, which in most countries is essentially an imported commodity. So, what have we been doing? So we have, been working with countries to strengthen their supply chains for premix. So a good example is we're doing work in Mozambique and Tanzania. And in Mozambique is we're essentially working with the Salt Producers Association and the government to set up a national supply system for potassium iodate. That's going to be helpful now during the COVID period, but also going forward, because that has been one of the biggest challenges on that program. So by the end of the year, we're going to have a system that's up and running. But the beauty of that is that 20% of salt in Mozambique comes from small, medium-scale producers who don't really have the capacity to import, but now they have access to that. We're doing something similar in Tanzania, working with the Tanzania Salt Producers Association, TASPA. It's already an existing mechanism, but what we're doing is strengthening the capacity of that and the ability for them to hold more stock and be able to reach more of the folks that were not fortified, mostly small, medium scale enterprises. We're not going to reach everybody, but 30% of that comes from SMEs. So we're going to get a portion of that fortified. The other thing that we're doing is on social safety net programs. I mean, if you look at the latest data from the World Bank, with COVID, the numbers that are being reached in social safety net programs are around 1.8 billion now globally. Now, that's an area where fortification hasn't really been active. Yes, fortification is a market-based intervention, but there's, over 1 billion people that are getting food, and it tends to be just, energy-dense foods. What is it that we can do and integrate fortified food? So our work in India, for example, is now growing in that particular area. So we're now working with at least 5 states to integrate, fortified wheat flour in their programs. So we're currently reaching about 28 to 30 million people, but we're hoping, that work is going to grow, going forward. And the other thing that we're also doing is, moving a lot of the training and capacity building online, doing, webinars and what have you, because obviously mobility and holding meetings within this context is difficult. I think the challenge we're finding is there's now just too many of the webinars and online type, training. So I think as a community, we're going to have to figure out, how we do some of the activities jointly, because there is now a fatigue with so many of these things that are being held online. So we have a solution, but we are now beginning to run into problems. So we need to think through this. And finally, the other thing we're doing is, making the case for fortification. Within the context of COVID. So collectively with 7, 8 other organizations, we published a brief about what various agencies and organizations and various stakeholders can do about the unfinished agenda of fortification within the context of COVID. But more importantly, also holding government to account and the industry to account. So, whether it's through articles in the press, whether it's blogs online, and continuously making the case. So fortification doesn't fall out, within this period and post-COVID. So in a nutshell, those are some of the things that we have been doing, which NGOs can be doing and others can be doing during this period. Thank you.
Thank you, Pinjani, very much. I'd like to introduce our 4th panel member, Deepika Matthias. Deepika is the Senior Program Officer at the Bill and Melinda Gates Foundation, leading their current portfolio of food fortification investments on the Global Nutrition Team. Her career has focused on the commercialization and market development of global health technologies, including her leadership of a global rice fortification program during her tenure at PATH. Deepika, please reflect from the donor perspective what donors can do.
Thank you, Ruth, for inviting us to participate on this panel. I think I'll just start with why we feel it's important for donors to be involved in fortification. We all know that fortification is a public health program that is carried out almost entirely by the private sector that bears about 90% of the cost of fortifications. That fact, coupled with the fact that consumers are not making their purchasing decisions based on the micronutrient content of the food, often results in markets that fail to form. And so the role of the donor is really to support the governments to catalyze these markets and to get them to a place where the supply chain is capacitated and fully incentivized to produce fortified foods. In the short term, the COVID crisis, donors can really ensure that the gap filling potential of fortification is maximized. I think Pinjani covered it very well in terms of some of the key areas of intervention. Number one, governments can prioritize access to premix, and we can support that through national stockpiles, zero cost levies. We know there have been disruptions to the more micronutrient dense value chains, such as animal source foods and vegetables and fruits and such. But even the fortified basic staples are part of international supply chains that have been affected by the pandemic. We can expand the use of safety net programs, prioritizing distribution of fortified foods within them, and also support the SMEs that are producing the fortified foods. And the irony is that the most fragile SMEs are serving the most nutritionally vulnerable consumers through this crisis and beyond. So I think there's a lot we can do in this short term to use existing infrastructure and support nutritional needs in the COVID era. In the longer term, I think donors need to really examine how we can strengthen and create more sustainable fortification program. The Gates Foundation, we're examining a few opportunities around the design and execution of programs by better leveraging technology, innovation, and the private sector. So on the design side, we know we're not optimizing our programs effectively. Standards are the bedrock of fortification programs, but only if they're established appropriately. And in some internal analysis we did at the foundation, we found that we're losing a significant portion of the potential, the gap filling potential for fortification, particularly for iron and folic acid, due to the wrong vehicle choice or fortification levels that are set too low. But in order to set those standards appropriately, we need good quality data on diets, on deficiencies, on effective coverage of other fortified foods, and many other inputs. So we think there's great opportunity for innovation around data and modeling innovation, and the establishment of a robust TA mechanism to support governments in making the right choices and continually refining those standards. Standard setting is only going to get more complex as more vehicles are added to fortification programs, consumption patterns evolve, biofortified foods are more widely available. And then the second aspect of designing effective programs, we also know that we need better enforcement legislation and regulation to accompany those standards. For instance, we know that 1/3 of the existing legislation for cereal staples do not include penalties for failing to fortify. So we need to identify and advocate for gaps in these regulations, and really, help them support the fortification standards that we put in place. So in summary, on the design end, we really feel like fortification is really limited by our program design. There's a greater opportunity to pay attention and innovate in this space. On the execution side, we believe that there's an opportunity to leverage technology. Fortification quality is really central to effective fortification programs, and we know that only 15 to 50% of fortified foods are actually fortified to standard, depends on the vehicle. Two key constraints that we see. Number one is a private sector value chain that is not optimally incentivized to fortify. And then second, a lack of a credible government enforcement mechanism. And one solution that now we're sort of experimenting with, and many of these tools are being rolled out, is the opportunity to digitize fortification quality data, capturing that data through, say, handheld devices, electronic dosifiers, other digital means, and that are connected to the cloud, and ultimately placing them on databases which are more accessible. And so we're exploring options like blockchain. This can have three effects. One, these digital tools can also create operational efficiencies within mills, but they create some sort of transparency with that fortification quality data. And if both can be accomplished, those mills could be incentivized to participate, to capture the gains and to improve quality of the products and kind of creating a race to the top. And we hope that transparency can be provided to both governments and maybe downstream buyers of fortified foods. We also think that digitizing fortification quality data can shift the collection of that data to industry and reduce the frequency required by governments for external monitoring and helping them to focus more on their enabler role. And the third benefit of digital tools, of course, is to extend the potential of fortification to the SMEs, which have largely been written off of fortification programs, yet they're so central to our ability to reach the most nutritionally vulnerable. So digital tools can enable monitoring from a distance. I do think there are two other domains of innovation. One is around partnership innovation, so how we accomplish our fortification goals. We really believe that partnership innovation can broaden ownership of fortification to private sector players beyond mills. So we see opportunity between premix suppliers and mills, for instance, for providing sustainable TA. So rather than the TA coming from a donor budget to a development partner to a mill, it can go directly from a premix supplier or a supplier, a manufacturer of other fortification inputs like dosifiers, electronic handheld diagnostic devices, and other critical fortification inputs. So we see an opportunity to more intentionally and effectively involve the private sector, and donors to build out and support those partnership structures. And then finally, we see the domain around product innovation. I think there's a continual need to improve micronutrients themselves to enhance our combinability, sensory, and stability profiles, particularly as we expand the set of vehicles into which the micronutrients are added. But beyond the micronutrients themselves, we need to continually examine whether we have the right vehicles. And are there vehicles that can fill gaps where other vehicles are falling short? This includes double and multiply fortified salt, bouillon, and other condiments. So in general, we need to be as flexible and as creative as possible. So none of these ideas are fast or easy. And the Gates Foundation is one of the largest donors in this space, but we can't do it alone. And we hope others view fortification as a critical priority as we do. We know that every dollar invested in fortification returns 27 in improved health and economic capacities, and that rivals the cost effectiveness of vaccines. So we really hope to go farther together and collaborate with other donors on some of these bold ideas. Thank you.
Great. Deepika, thank you so much. And thank you to all the great panelists and the presenters. We're unfortunately at the end of our time. This has been very informative. Appreciate the attendance and appreciate the participation for all. And have a good rest of your day, evening, or middle of the night, wherever you are in the world. Thank you. Bye-bye.